The importance of colorectal cancer screening, presented by Denise Mathis, BSN student at Indiana State University. At the conclusion of this activity, participants will be able to describe what colorectal cancer is, identify the occurrence of colorectal cancer, list the colorectal cancer risk factors, recognize the signs and symptoms of colorectal cancer, explain what a polyp is and the role it plays, interpret strategies for early detection and treatment, outline the rate of survival from colorectal cancer, and finally apply the resources listed to begin a healthy discussion about colorectal cancer. Population at risk is adults. Please take a moment and complete the pretest. So what is colorectal cancer? According to the American Cancer Society, colorectal cancer begins in the colon or in the rectum. They are also identified by where the cancer is located. It is collectively known as colorectal cancer because they share many features. Together, the colon and the rectum make up the large intestines, which is where food is absorbed and digested. Statistics. Let's be honest, no one likes to talk about their bowel habits and poop, but according to the American Cancer Society, colorectal cancer is the third leading cancer among both men and women in the United States. They estimate that in 2021, there will be 149,500 new cases and 52,980 deaths in the U.S. alone from colorectal cancer. Risk factors. There are several risk factors in developing colorectal cancer. Non-modifiable factors include age, race and ethnicity, family history of colorectal cancer or colorectal polyps, genetic syndromes, history of inflammatory bowel disease such as Crohn's or ulcerative colitis, and type 2 diabetes. Modifiable risk factors include lack of physical activity, a diet missing fruits and vegetables, low fiber and high fat diets, diets containing high processed foods, overweight and obesity, alcohol consumption, and tobacco use. Signs and symptoms. The signs and symptoms of colorectal cancer mimic most other conditions. Signs and symptoms include weight loss that would be sudden and unintentional. Stool changes include observing narrow or pencil-like stools. Rectal bleeding, which can show as blood streaks on the stool. Abdominal pain and bloating. Constipation or diarrhea, or a combination of the two. A decrease in appetite, vomiting, weakness and fatigue, anemia and jaundice. Polyps. Most colorectal cancers begin as a growth in the inner lining of the colon or rectum, which is called a polyp. There are different kinds of polyps that determine what kind of cancer will develop. Adenomas are considered a precancerous condition. Hyperplastic polyps and inflammatory polyps are the most common and generally non-cancerous. SSP, or sessile serrated polyps, and TSA, traditional serrated adenomas, are considered high risk for colorectal cancer. Other determinants of the likelihood of a polyp being cancerous are if the polyp is larger than 1 centimeter, 3 or more polyps are found, or if dysplasia, which is an abnormal growth of cells, is seen in the polyp at biopsy. Early detection. Colorectal cancer is a slow-growing cancer. A polyp can take 10 to 15 years to develop into cancer, but that cannot deter you from screening. It is important to follow your healthcare provider's recommendations for screening, especially when there is a family history of colorectal cancer. Screening is the most powerful tool that you have. Home screenings include fecal blood testing and fecal DNA testing, such as Cologuard. Fecal testing should be completed every 12 months and DNA testing every 3 years. Colonoscopies are considered the golden standard of testing. Colonoscopies are to be completed every 2 years for high risk regardless of age, and every 10 years for those at average risk. CT colonoscopy is a CT scan of the colon and used for those that have testing limitations. Since the introduction of the Affordable Care Act, private insurance companies and Medicare have been required to cover these costs because tests are being recommended by the U.S. Prevention Task Force. The American Cancer Society recommends testing beginning at the age of 45 and recommends testing from the U.S. Prevention Task Force at the age of 50. Always check with your insurance company regarding coverage. Treatment. Johns Hopkins Hospital indicates that treatment is specific to the stage or extent of colorectal cancer. A colonoscopy to remove the suspected polyps is first and foremost. Surgery is the resection of the affected region and margins. Factors that can determine if you are a candidate for surgery is the location of the targeted tumor and the presence of other cancers, the stage of the cancer, and personal preference. Chemotherapy is a delivery of drugs that will destroy cancer cells and tumor cells that may have broken off from the original tumor and growing elsewhere in the body. It can be used to shrink tumors as well. This can be done at any stage of cancer. Chemoradiation is a combination of chemotherapy and radiation treatment. Survival rates. According to the American Cancer Society, a relative survival rate compares people with the exact same type and exact same stage of cancer with the entire population. Survival rates are based on the location of the specific cancer. The rates are based on the following groups. Localization, which means there is no sign of cancer has spread outside of the colon or rectum. Regional, which means the cancer has spread outside the colon or rectum to nearby structures or lymph nodes. And distant, the cancer has metastasized to other parts of the body such as the liver, lungs, or distant lymph nodes. The listed survival rates are based on data from 2010 to 2016. Resources. It is important that you not only seek medical care, but also mental health care. There is a plethora of resources available to educate yourself about colorectal cancer. Educating yourself and prevention are the best weapons against colorectal cancer. But do not be shy about your colon health. Talking about it could save your life or the life of someone you love. Finally, please take a moment to complete the post-test.